Hello everyone, welcome back to the channel Microbial World. In today's video, we are going to learn about Clostridium difficile infection. Clostridium difficile, commonly called as C.diff, is a bacteria that can cause serious infections in the intestines, especially after antibiotic use. So, understanding its causes, risk factors, and treatment is important, particularly in hospitals and long-term care settings. Clostridium difficile is a gram-positive, spore-forming anaerobic bacillus. Normally, it doesn't cause any problems because the good bacteria in our gut keeps it under control. But in certain situations, especially when someone takes antibiotics, it can grow out of control and cause disease. Therefore, it is one of the most common causes of antibiotic-associated diarrhea and can lead to a serious condition called pseudomembranous colitis. It is found in the intestinal flora of some healthy individuals and also in hospital environments. Clostridium difficile has some special features. It is gram-positive, meaning it stains purple in gram staining. But sometimes because it makes spores, it may appear gram-variable. It is an obligate anaerobe, which is why they cannot survive in the presence of oxygen. Oxygen is toxic for them. They produce spores that are extremely resistant. These spores can survive in the hospital surfaces for months. This is why outbreaks happen so easily. Its main disease-causing ability comes from the toxins that damage intestines. Pathogenesis. As we said earlier, under normal conditions, our gut flora keeps Clostridium difficile in check. But when a patient takes antibiotics, especially strong ones like clindamycin, cephalosporins, fluoroquinolones or ampicillin, the normal gut bacteria are killed. This gives Clostridium difficile a chance to proliferate. Clostridium difficile then releases two major toxins, toxin A enterotoxin and toxin B cytotoxin. Enterotoxin attracts white blood cells, increases fluid secretion and causes diarrhea. Cytotoxin is even more dangerous. It damages the cells lining the colon, leading to tissue necrosis and the formation of pseudomembranes. Together, these toxins causes inflammation, fluid loss and tissue damage. Clinical manifestations. The symptoms depend upon how severe the infection is. Antibiotic-associated diarrhea results in watery diarrhea, foul-smelling stools, cramping and abdominal discomfort. Pseudomembranous colitis is a classic condition. It is the severe inflammation of the colon caused by Clostridium difficile toxins. It is called pseudomembranous because of the presence of yellow-white plaques on the surface of colon. They are made of dead cells, fibrin, mucus and inflammatory debris. It can cause abdominal pain, leukocytosis, that is increase in the number of white blood cells in the blood, and also fever. Fulminant colitis is the most severe, life-threatening form of colitis. The complications include toxic megacolon, that is the massive dilatation of the colon which can rupture. It can cause perforation of the colon, which results in the leakage of bowel contents into the abdominal cavity, leading to peritonitis. Fulminant colitis also causes sepsis and multi-organ failure. Certain groups are at higher risk of getting Clostridium difficile infection. People who use broad-spectrum or multiple antibiotics for a long time, hospitalized patients, especially in ICUs or long-term care centers, elderly patients above 65 years. Immunosuppression is another important factor, that is, people who are having weak immunity. People who also take proton pump inhibitors, This is because proton pump inhibitors reduce stomach acid, allowing spores to survive the stomach and reach the intestines. Diagnosis. Doctors can diagnose Clostridium difficile infection mainly through stool testing. ELISA test detects toxins A and B. PCR test detects the genes for toxins. Endoscopy is not always needed, but in severe cases it may be needed to look for pseudomembranes in the colon. Treatment. The first step is to stop the antibiotic that triggered the infection if possible. For treatment, oral vancomycin or fidaxomicin are the preferred drugs. Metronidazole was used earlier, but it is less effective, especially in severe cases. In case of recurrent infection, fecal microbiota transplantation can be done. This means transferring stools from a healthy donor into patient's intestines for restoring the normal gut bacteria. Supportive care is also important, such as fluids, electrolytes, and surgery in severe cases. Preventing Clostridium difficile infection is as important as treating it. Judicious use of antibiotics, that is, you need to avoid unnecessary prescriptions. In hospitals, strict infection control is needed. Patients with Clostridium difficile should be isolated. Staff must wash hands with soap and water. This is because alcohol sanitizers do not kill spores. Sporicidal disinfectants should be used to clean surfaces and equipment. Let us quickly revise what we learned in today's lesson. Clostridium difficile is a gram-positive spore-forming anaerobe. It is the main cause of antibiotic-associated diarrhea and pseudomembranous colitis. The infection is caused by toxin A enterotoxin and toxin B cytotoxin. Risk factors include antibiotics, hospitalization, old age, and immunosuppression. Diagnosis is based on stool toxin test, PCR, and endoscopy. For treatment, oral vancomycin or fidaxomicin are the drugs preferred, and fecal microbiota transplantation for recurrent cases. You can prevent the infection through proper antibiotic use and strict infection control in hospitals. I hope that the video was useful for everyone. Do subscribe the channel for more informative videos. Thank you for watching.